Hi, this is Dr. Gilman, and I'm here to talk to you a little bit about ketamine-assisted psychotherapy. Ketamine, you say, why in the world would I take ketamine? Isn't that a veterinary drug or something people used to roll on in nightclubs? Well, the reality is that the FDA has approved ketamine in many applications in terms of mental health issues and conditions, including chronic depression, anxiety, post-traumatic stress disorder, and many, many, many other uses. And here at the center, we've been particularly interested in the integration of using ketamine-assisted psychotherapy and working with couples. Ketamine is actually known as an ego lubricant, meaning that it's creating some space between you, your authentic self, and all of your defense mechanisms, all of your projections, all of your assumptions, all of the limiting beliefs you hold about yourself and your partner. And so what we're finding in treatment with couples is that integrating ketamine in a very structured and facilitated way and using the developmental model is, sorry for this, but a marriage made in heaven. In order to look into ketamine-assisted psychotherapy, you do have to go through some hoops, and they're important. The first one is that each partner needs to be cleared by a medical professional in a medical evaluation that can take place via telehealth. And then you also need to speak to me to make sure that there are no psychological contraindications for using ketamine. It's also not great to use ketamine in your partnership if you are in collective or individual crisis of any kind. But where we're really seeing major uses for ketamine in our couples work is in working with couples in which there's been gridlock for maybe years or even decades. That is to say, there's been insight and gains made through couples therapy, but people are still struggling to really break through reactive patterns that exist between them. You know, that experience of, gosh, we've tumbled down the hill again together and we don't even know how we got here. Ketamine is proving to be an extremely powerful tool in breaking through those reactive patterns and allowing people to reconnect in truly profoundly intimate ways. And at the same time, the additional benefit of ketamine is that ketamine actually creates new neural plasticity. That is to say, it creates new neural pathways for connection and for experiencing yourself and your partner in new ways and ways that are quite lasting, as well as a lot of empirical evidence that supports the idea that ketamine can decrease or in some cases even eliminate longstanding depression or dysthymia or anxiety. And also stress and trauma response. So if you're interested in learning more about ketamine-assisted psychotherapy as a tool in your partnership, please feel free to reach out to me. Thanks so much.